Hello, everyone, and welcome to the Leg Club podcast. Our guest for this episode is Lusi Sheehan, also known as the Wound Educator, and she's here to talk to us about the role of pharmacists in wound care. Lusi Sheehan is a credentialed wound care clinician and accredited home medicines review pharmacist. She has a postgraduate degree in wound care management and helped establish pharmacy-based wound and compression clinics in Perth, Western Australia, where she provides collaborative care to the community. Lusi is the current Education Liaison member of the Western Australian branch of the Wounds Australia Committee. Lusi created the Wound Educator on social media pages to improve wound care literacy in the community and minimise harm caused by wounds. In 2023, she created the Wound Care course for pharmacists and team. Lusi, welcome to the Leg Club podcast. Can you tell us what role a pharmacist can play in providing wound care to the community?
Thanks, Dan. Pharmacists are one of the most accessible health professionals in the community. We're often the first point of call for a patient who has a wound, and they come to us looking for advice, product recommendations, or to help them dress their wound. Wound care has evolved a lot over the years, and there's so many products on the market that it can be very confusing for patients, as well as ourselves as health professionals. It seems so important that we stay up to date with the latest best practice guidelines in wound care and understand the rationale when providing dressings, because what we say or recommend can determine the path and outcome of their wound healing journey. I also see ourselves as the triage to other health professionals. Pharmacists can provide what is within our capacity, and this can vary depending on the individual pharmacist and their level of training and expertise, as well as our scope of practice. If it's something that's beyond our capacity, we can then refer them on to doctors, specialists, nurses, or onto wound clinics or hospital services.
That's great. So, can you please share with us what services you provide for patients in the pharmacy-based wound and compression clinics that you have established?
Sure. So after I completed my postgraduate degree in wound care at Monash University, I wanted to apply and use the knowledge that I've learned. The pharmacy I work at in Perth, Australia, has an older demographic generally, and many of them will come in with skin tears, cuts, and grazes. Post-operative wounds are also very common because of the high prevalence of skin cancers in Australia. I often hear people tell me that they want to dry out their wounds or they've been told to leave it open to air out. So I often provide some education on the latest evidence of wound healing, that wounds heal faster in a moist environment rather than leaving it open to scab. If patients also like to get some help with their wounds, I will use our wound care service protocol to assess and provide a treatment plan that includes the goals of care based on the patient's needs and medical history. I will also follow up on them regularly to review their wounds, take photos, and document the progress and update the healthcare providers. I teach patients how to provide first aid, such as if they sustain a burn or skin tear. Many of my patients do heal quite well, and they're always really grateful for the outcome. Sometimes I will need to refer patients with signs of infection or wound complications that needs to be investigated, such as diabetic foot, suspected skin cancers, or chronic venous ulcers. And it's absolutely critical that we do this promptly to avoid delays in care. We also work closely with our patients' local doctors, podiatrists, surgeons, and other allied health professionals to provide ongoing care, such as skin care and compression therapy for their lower leg edema or leg ulcers.
Do you have an example of a patient you've helped?
Yes, a memorable patient was a man who was in his 60s who was referred to see me to manage his lower leg edema by his doctor. He also had a wound that's been there for several weeks, probably about 4 or 5. He's been using a local antibiotic, mupirocin ointment, which unfortunately isn't part of the guidelines for local wound infections. So we talked about alternative topical antimicrobial agents that are evidence-based that we could try, and he was keen to give it a go. So after about 1 to 2 weeks of dressing and reviewing the wound, I realized it wasn't progressing as I expected, despite applying wound hygiene, dressings, and compression stockings for his lower leg edema. So I sent him back to his doctor with a referral letter to check for skin cancer. And the patient called me back the next week to tell me that it was indeed a skin cancer. He's going to have it cut out, and I might have just saved his life.
That's fantastic. Really well done. So, what are some highlights of your experience as a wound care pharmacist?
I would say probably the people that I've met along the way that I see as mentors. I first met Professor Jeff Sussman in Melbourne when I worked with a community pharmacy group there. And I just remember him saying to us, do not leave betadine on for more than 3 to 4 minutes. And we were all thinking, what do you mean don't leave it on? People do it all the time. And that just shows how little we knew back then. He took us to the hospital wound clinic where he worked at, and it was a real eye opener for me into the world of wound care and the impact that a specialized wound care clinician and the team can make. It would also be appropriate for me to mention in this podcast that I went on a trip to Europe and attended the Lindsay Leg Club conference back in 2018. I had the pleasure of meeting Lynn Bullock here and learnt all about the Leg Club Foundation initiatives and their social model of care for people suffering from chronic leg conditions. And I thought it was just brilliant. I also recently had the pleasure of meeting Gary Bain, the wound guy from Australia, and started a collaboration with him to further improve wound care education for our woundiverse, as he would call it. And he actually introduced me to this podcast, and I'm really excited to join forces with him to work together on our mission and vision.
Wonderful to hear, Lucy. You are known as the wound educator. How did this start?
Well, I see wound care as a specialty, just like diabetes or cardiovascular disease, and it should be treated as a condition. My goal with the Wound Educator is to extend my knowledge and experiences to the wider community to improve wound care literacy and minimize the harm caused by wounds. As one person, my capacity to help people is limited, but if I can help more people become wound care champions, then hopefully wound awareness can extend exponentially in the community. I created the Wound Care course for pharmacists and team to help equip pharmacists with international best practice guidelines for wounds and the rationale for the use of dressings and topical antimicrobials, particularly with antibiotic resistance as a growing issue and becoming a global crisis. I understand that not all pharmacists and assistants are involved in providing wound care services, but it is so important that we provide them with the right advice from the start and work with our local healthcare services to refer people at the right time.
Okay, Lucy, final question. What's on your wish list?
Well, in Australia, wound care in community pharmacies are not funded, so patients have to pay out of pocket to purchase dressings and utilise our wound care services. And this may be different for other countries around the world, for example, in the UK, where dressings may be subsidised under the NHS. In Australia, 420,000 people suffer from chronic wounds every year. Over 3 billion of the healthcare budget is spent on chronic wounds, and each patient spends over 4,000 on out-of-pocket costs. So in an ideal world, I'd love for wound care to be free for all. I'm always keen to work with stakeholders and organisations to improve funding for wound care in primary care, improve collaborative care through better referral pathways, as well as reduce the economic and social impact of wounds on our patients nationally.
Thank you, Lucy, for speaking for the Leg Club podcast, and I trust that she has given our listeners some insight into the role that a pharmacist can have in the area of wound care. And that concludes this episode of the Leg Club podcast. Thank you for supporting the Leg Club, and until next time, take care.